Now, let me pick up on something you said earlier, and it is our greatest challenge, that many of people in California who suffer from behavioral health challenges end up in one of two places: jails or hospital emergency departments. Could you talk a little bit about how we fix that problem? I know many hospital leaders across the state are frustrated. Hospital emergency departments will always be the place people come when they're in need of emergent care. But now we're seeing just a demand for that and an overflow. There's a frustration about not being able to get people the right care in the right setting. Could you talk a little bit about what's driving all of this to hospital emergency departments and jails, and how we might undo that?
Yeah, well, obviously, the world that we want doesn't force people into crisis that requires them to get emergency care. So if we were doing this well, which means if we had moved upstream and we could provide people the services when they need them, where they need them, the hope is that we can reduce that pressure on emergency rooms and reduce the pressure on first responders. But we should really take this as an opportunity to also rethink what first response looks like, and to say maybe there should be psych ERs, maybe there should be first responders who can come with a peer and come with a nurse and come with someone who has real in-depth knowledge of psychiatric emergencies. Oh yeah, so the opportunity to develop an entirely different looking first responder system. Maybe it doesn't have a 911 code to trigger it. Maybe you don't see an ambulance, but a van. Maybe the people in the van aren't heavily armed, but they're people who have lived experience, as well as understanding what you might require for a psychiatric emergency. And by the way, maybe they don't bring you to the hospital or to a jail. Maybe they bring you to a psych ER, from which you might go to a crisis residential service. There are other ways to do this, and they're being done in many places. We need to scale that and make sure it works.
And as we've taken a look at alternate destinations, mental health ERs as an example, sobering centers, it's about thinking differently about how we provide care in the state of California.